Hi, thank you for bearing with us. We are back again, and it gives me great pleasure to introduce my colleague and a trustee of the charity, Dr. Ian McPherson. Dr. Ian is going to talk through the first part of our presentation, and then I will talk the latter part, and then we'll take some of your questions, which Christy, our colleague, has kindly agreed to read out. So over to you, Ian.
Hi, sorry about the delay in getting to you. As Ali said, I'm Ian McPherson. I'm one of the trustees of Cardiomyopathy UK, and I'm also a board. I'm also, in terms of my background, I'm a clinical psychologist, and I've worked in mental health for my whole career. One of the reasons I became a trustee was because I found out that Cardiomyopathy UK were very keen to look more at the mental health side, and in terms of trying to get a better understanding of the emotional impact of having this condition for both people living with it, but also people who are their family and friends. So if we could go to this first slide. Yeah, I mean, why should we be interested in it? Well, we've had loads of feedback. We've got support groups in many parts of the country, and it is a regular topic that comes up there. I attend the support group in the West Midlands because I have hypertrophic cardiomyopathy, and it's a regular theme where we're talking about things. We get it back very much too from the helpline and our Facebook group. Those of you who are members of the Facebook group or have used will have seen a lot of the issues are not about the physical elements of it. We get it from our clinical advisory group. We are very fortunate of having very close links with a lot of clinicians, many of whom have presented today, and as a result of that, we know that they know that there are mental health, emotional impacts, but that they don't feel that they have been able, up until now, to be able to do very much about it. But we also, back in 2016, we did a survey on emotional health and well-being, and I'd like to share some of the results of that. So if we could have the next slide, thank you. In terms of the survey, we asked people, it was an online survey, it was done for us. It's not a big formal research study. It was just tell us what you think. And we got both quantitative and qualitative. That's both people giving numbers and also giving their own statements. So we got a very good response, 385 from people who are living with the condition, and very good for the other one too, lower, but it showing, as we know, that that this condition can have a big effect on family and friends and carers. Next slide, please. So this is just an indication of what people said. We had almost a quarter of people saying that it affected them most of the time. So that's people who are very aware of the condition, and it's actually impacting on their emotional well-being. About a third saying it affected some of the time, and a relatively small number saying it was only occasionally, 13%, and only 8% saying that it didn't have an impact. So we're saying around 90% of people who are living with this condition have experienced that this detracts from their emotional well-being. We move to the next slide, please. These are just some quotes, and because we asked people to give us feedback, and as a consequence of that, we got what people said, and sometimes that conveys more than figures. And this also shows the range of experiences that I think we've slipped forward a slide, Ali. Yeah, the first one showing that it can have a major impact on some people, and a sort of nagging reminder, the second. And then some people saying, yes, it did have an impact, but less as things went on. So we go to the next one. So how would you like support? And this again shows that we're all individuals. If that's one of the things that's been repeated throughout today, we might have the same condition, but we've got very different experiences. So we wanted to know what would help people. And these are, I won't read them out, but you can see there are 3 examples there. And I would hold on to the third one, because that's something that concerned us particularly, how difficult it is when people want emotional support to ask for it. And that's something I'll come back to in a moment. We go on to the next one, Ali. And then at the different stages, and as you can see, different people wanted different things. But what it comes across is there are stages in the condition and the varying stages we go through where people feel it's more testing. And as I say, not surprisingly, when people early on, when they first diagnosed or got symptoms, but then there's a choice for some people, not for everybody, about whether they should have an ICD implemented. For people with families, very often big and quite challenging issues about genetic testing, as you will have heard from speakers, or some of you will have heard speakers this morning. Not surprisingly, when the condition got worse, but also when the condition got better. And that's one of the things we must remember, that very often, and for some people with some conditions, once they actually get the right treatment, they start getting better. But if they've been very poorly and then they don't quite know what they can do, am I going to be fit enough to do this? Am I putting myself at risk? And for a number of us, including myself, the condition can lead to heart failure, which sounds very dramatic, but isn't. It just means your heart's not working very effectively. And because of that, that can actually restrict things you can do. And that can be a major issue, particularly if people have enjoyed sport or activities. So a lot of issues there that we pick up on. If we move on, Ali. So these again are just some quotes which I think bring home how strong it can be, and particularly the first one, when somebody had had a shock. It didn't say whether it was appropriate or an inappropriate shock. You can get shock sometimes just because your heart goes very fast until they get it fine-tuned. But whether it's appropriate or not, this person felt abandoned. So they got all the physical treatment, but felt there was nobody to talk about how they felt. And for those of you who have had shocks, appropriate or inappropriate, I think you will know it can have quite an impact. On the more positive side, though, there's when people are feeling very bad, having somebody you can connect with, and in this case, connecting through their carer. And again, one of the things we offer, and Ali will be talking more about this, is somebody, a peer supporter, somebody who's got the lived experience of the condition and has had some support in being able to talk. So having somebody to talk to, and that again is an important theme. Somebody you can talk to, or in this case, talk to even via family member. If we could move on. So other survey findings, and this is ones that would be interesting, see how people react to this, but the vast majority of people with cardiomyopathy have not been asked about the emotional impact by any healthcare professional. And that's not just the cardiology team, that is people in primary care or anybody else they've come in to talk to. Equally, most people who have not brought up emotional impact with a healthcare professional, and people said, well, it's difficult, and clinics are very busy, cardiologists and the nurses are very busy. But the two things there, we know a lot of 90% of people have a big emotional impact, but they don't either get the chance or take the chance. It was also quite a variation. Some people were quite comfortable in discussing the emotional impact with family or friends. Others, however, said they found it difficult. And I've seen in one of the questions where people worry more about their family than worrying about them. And it's a two-way thing. And worryingly, a third of people felt they couldn't discuss the emotional impact with anyone. So that is a very clear message. This is not just something that is minor or only affects a few people. It affects the vast majority of us who can experience emotional impact at varying levels, and most people don't have an easy outlet for that. So that gave some messages to us as an organisation. If we could move on. Firstly, we felt it was very important to encourage people, and when I say that, I'm saying myself, to talk much more about the psychological impact, help our colleagues in cardiomyopathy services to see this as a significant issue for many people. And I'm pleased in many of the more clinical sessions I looked at this morning to have our colleagues making reference to the emotional and psychological impact and the interaction between these. We also felt we needed to encourage more interaction between cardiomyopathy services and mental health services. And we've done this in a number of ways, particularly bringing people together because sadly, the way the health service works, people tend to work a little bit in silos, and the people in mental health don't have a lot of contact with the people working in cardiology or vice versa. But this is not just about cardiology. This is true for almost all mainstream conditions where there isn't enough interaction, although we know that having a long-term condition, about between 30 and 50% of people with that will develop clinical levels of, and that means ones that require intervention, of anxiety and depression mainly, but the chances are they won't be able to access that service, and we can talk a bit more about how that is moving on. And it was also a big drive for us to co-produce services to try and address the psychological impact of cardiomyopathy, and particularly for us to recognise that actually a lot of the things that Cardiomyopathy UK has done for many years actually is giving a lot of very good emotional support to people. And I'll hand over to Ali now to talk a bit more about how that operates.
Thanks, Ian. So, as Ian said, we recognise as a charity that emotional well-being with any long-term condition, obviously in our case, cardiomyopathy, heart muscle diseases, that mental health and good emotional well-being is on an equal footing and should be on an equal footing with physical well-being. So our services are tailored holistically to good physical well-being, good welfare, so making sure that finances and housing and employment are all secure, but also good emotional mental health. So we have one-to-one emotional support. So we have a number of volunteers and staff who are trained to provide not just a listening ear. I think it would be fair to say more than just a listening ear. So they are trained to sit with people who might be distressed, who might be angry, who might be quite apathetic, who might be questioning their mortality. So we have specialist trained volunteers and staff who can provide that one-to-one support, because some people, they don't want to within a support group, whether it's online or face-to-face. They want to talk to just one person privately. We offer this support through the telephone, so just through a call or text or email. And some people do like this because not only is it personalised and individual support, it also, for those people who want to preserve some level of anonymity, it allows that to happen as well. Really important that our people feel safe when they're accessing support. So we, some of the most common area-specific, psychologically specific areas of concern that the people call us with or contact us about is anxiety, depressed mood. Now, I'm clear here, some people call us and they have a diagnosis of depression. Some people call us and have depressed mood. So they are quite different. Fear, confusion, disbelief, anger. So we have to make sure that our services are able and our volunteers are able to kind of understand, be able to understand and recognize these emotions in people, and to kind of empathize and work with that person. We have our support groups. So these were physical support groups up until the time of the pandemic. So these were a network of support groups throughout the UK. They are currently online. And generally with a support group, you'll have a speaker come in and talk about nutrition or mental health or medication. And then the time is given over to questions and answers, and then also for that all-important pandemic. So these were a network of support groups throughout UK. They are currently online. I can just hear somebody talking. You'll have a speaker. Oh, okay. Sorry about that. So there's a little bit of talk in the background. Okay. We also have our issue-specific support groups. So we have a number of online support groups where we talk about a specific issue or a specific cardiomyopathy. So we've had a Takotsubo online support group, an ARVC online support group. We've had an atrial fibrillation support group, genetics. So we do have issue and condition specific. And we also have groups for carers and supporters, children, young people, and so we cater for different individuals. We also have the coffee and catch-up sessions, which are tailored really to provide respite. We had an atrial fibrillation support. That's I think Ian's gone. Okay, sorry if you heard any of that. So with Coffee and Catch Up, they provide respite. So they're a little bit different to our support groups. Our support groups are, like I've said, they're a lot more structured. You have a speaker who's invited, the Q&A, and then meet other people. With the Coffee and Catch Up, it literally is as it suggests. So it's feet up every Friday, 2 till 3 p.m. British Standard Time, online via Zoom, and just chatting to other people. And we've talked about a whole breadth of different issues, and not just even issues, just stuff, so they're usually good fun, but they're also useful because it allows people to take the focus from COVID-19, to take the focus from cardiomyopathy or whatever is worrying them at the time, and just to kind of sit back and just connect with other people. Signposting. So we recognise part of being an excellent charity and an excellent provider of support is recognising that there are other specialists who can do different areas of work better than perhaps we can because we're focused elsewhere. So what I mean by that is if we have anyone who has been bereaved, then we do provide, I would call it like a low-level bereavement support. So, kind of being able to sit and empathise with someone. But for anybody who was really struggling with bereavement, then we would obviously signpost them to a more appropriate and resource provider who works in bereavement. So we signpost where appropriate, but much of, there is a whole cache of what we can do, but we do recognise that there are other places where we are not expertise, such as in bereavement or perhaps with working with young children. And as well with advanced heart failure and end of life, we are looking to kind of improve our work around this area as well. We have recently released 2 fact sheets about breathlessness and frailty, which were part of our advanced heart failure suite of information that will be coming out. Okay, so what is it we are offering our people, our community? What is it we exist to do as a charity? So we have our trained and experienced volunteers and staff who have different experiences, qualifications, practice, disciplines in various areas. We have our cardiac specialist nurses on our helpline who are available 8:30 till 4:30 Monday to Friday and are also present in our closed Facebook groups. We have our diverse peer network that I mentioned. So we have so if you wanted to speak to somebody in your local area around your age, same gender with the same condition, who's also going to have an ICD or an ablation or a myectomy, then we will try and match you with somebody as close to those needs and those specifics as we can. We do provide welfare and benefit advice. So we recognise that it's all well and good to provide clinical information advice and good mental health information and advice, but also there's that stuff called life that happens in between when, you might not be well enough to work for a period of time, or you may be in between jobs because of your health and you may need a little support, or you may need help explaining to an employer why you need regular time off to attend cardiac rehab. We can help people, and we do help people with that and advise them the best way to do that. We place at the heart of everything we do, and well, I was trying to think about it the other day. What is it that if I could coin three elements that are at the heart of everything that all the staff and volunteers offer our community? And I think it's empathy. I think we try to understand where you're at, what you need, and how we can meet those needs. And because many of our volunteers have the condition or have support someone close with the condition, we're quite easily able to do this. So we're congruent as well. We will always say what we can do and the offer of support that we can provide. But if there is something that you need that we aren't the specialists for, then we will signpost accordingly. So we're very honest and clear about what support we can offer. And we understand, we try to understand how our community is affected. As you can see with our rapid COVID-19 response, we try to understand the kind of the fears and the worries around, should I isolate, should I shield, am I vulnerable? And we responded accordingly in myriad ways. We are not one or two cardiomyopathies specific. We cover all cardiomyopathies and myocarditis. So I know that some organisations provide support for one particular cardiomyopathy. In fact, ourselves, many moons ago, when we were first set up, were known as the Hypertrophic Cardiomyopathy Association. But we support people with any and all type of cardiomyopathy. And when we say that our volunteers and our community shape our work and our services, we really mean that. Our trustee board, so the people who are legally responsible for the charity, our bosses, they all have either cardiomyopathy themselves or they have close links with cardiomyopathy insofar as they support someone with the condition. All our volunteers are affected by cardiomyopathy, again, either first person diagnosis or caring for someone close. And we are always we are always surveying and asking our people, what is it you need? How can we help you to live better with your condition, to manage better? How can we improve your confidence? How can we help you shore up your self-esteem? How can we reassure you and walk with you on your journey? A couple of things that I think makes us quite different as a charity to perhaps other charities who specialise in cardiac support and heart support is that we are cardiomyopathy specific, as the name of the charity suggests, and that we have a dedicated cardiac specialist nurse helpline. I think that makes us very different. The fact that we have a very good reputation, not just in the clinical field, but also with the kind of bigger funders, so people like Children in Need, the National Lottery, they are the types of people who fund us because they respect that the work that we do is valid, that it is reflective of our community's needs, and that we do exactly what we say that we will do. So we are respected. We are multidisciplined. We have our clinical advisory group, which is the group of clinicians who input and advise and support at strategic level, right down to our fact sheets, fact-checking our fact sheets annually to make sure that they are medically accurate. We have a diverse trustee board with trustees with very different skills, qualifications and expertise, the same with our volunteers and the same with our staff. So we have a multidisciplined approach to the work and the support that we offer. Again, just going back to, I think, about the respect that we are with our public and professional engagement. You will find us at a car boot selling cakes to make money, but you will also find us in Whitehall lobbying to make a change and make differences to people affected by heart failure and or cardiomyopathy. So we are, in that respect, from one end of the spectrum to another, all valid points across the spectrum, but we are multi-tiered in that respect. And we're all committed to one common aim. We want things to be better for people with cardiomyopathy and heart muscle disease, myocarditis. That is the bottom line. That is what the charity was set up 31 years to do. That is what we are doing today through this conference, and we continue to do day in, day out. Community-based, we are our community. Our services are community-based. All of our services are community-based, because the heart of the community is what the charity was kind of established to embody, you know, if you like, to kind of make people aware in the public arena of what cardiomyopathy is, to make sure that people with cardiomyopathy are treated fairly and get a better deal clinically through the DWP, so through welfare and benefits. And we adapt. We're very adaptive. You know, if you any of the people who've attended the COVID-19 support services that we've put on will see that we are adaptive. Okay, so I know that we did have time for questions and answers that I think that I've possibly eaten into. So what we have a welfare Q&A this afternoon. So if you, the audience, are okay with this, and indeed Ian, we will roll those questions over and answer those within the welfare. So these were just to look at those quickly is some of the rapid response that the charity met the pandemic with. So we had our respite sessions, we delivered the life after lockdown. So for those people going back into work after shielding or isolation, or those people sort of venturing out into their community, we provided them with psychological and emotional support. And we increased our opening hours and increased the support offers from our telephone peer support volunteers. So I think that brings us to the end. Like I say, I'm sorry that we've kind of gabbled on, or I've gabbled on. We've run out of time for questions, but we will put them in the welfare Q&A this afternoon, where Ian and myself will be present to answer them.